You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. As we close out our 2021 Nurses Week series, today guest host Kelly Robke interviews Dr. Tim Raderstorf, Chief Innovation Officer at Ohio State University School of Nursing.
Welcome to the podcast, everyone. I'm very excited to have Dr. Tim Raderstorf here with us today from the Ohio State University School of Nursing, speaking about an issue near and dear to his heart. Tim is such an incredible nurse leader. As an innovator, he's one of my heroes and one of my mentors on my dissertation project for my DNP. Thank you, Tim, for making the time for us today. And I would just like for you to share your nursing journey with our listeners. It's a very incredible, very unique and compelling path. Would you mind sharing some of the highlights from your nursing career?
Sure, I'd be happy to, and thank you for the very kind introduction. I look to you as a mentor and for inspiration as well. So it's an honor to be here with you today. I'm what I call a little bit of a bent arrow. So I grew up from a place of immense privilege. I went to a Catholic prep school. And when you were good at math and science, they told you to be a physician. So I went to college, enrolled in pre-med, and kind of ignored all the flags that were telling me that clinical care was really where I wanted to be as a nurse, not as a physician. So I ended up working my first summers out of college at a summer camp for kids with hematology oncology disorders, mostly HIV, sickle cell, and cancer, and saw what the nurses did there and was just one of those light bulb moments of, oh, this is where I need to be. So I went and got a direct entry program. I used that pre-med degree to get into nursing school and went and got my master's in nursing from Xavier University in Cincinnati. Started out as a floor nurse at Nationwide Children's Hospital and then quickly transitioned into leadership roles that eventually led to me having the Chief Innovation Officer and faculty role at Ohio State's College of Nursing.
Wow, thank you for that. And I learned something new about you every time. I too began my career working in blood disorders, but on the pregnancy side in hemoglobinopathies, sickle cell trait disease, and also HIV. That was just some incredible work back then, but thank you for reviewing that. The first thing I wanted to ask you about today is if you could tell us a little bit about the genesis and the necessity and the call to action around Nurses Everywhere.
Yeah. So Nurses Everywhere is a nonprofit that I was fortunate to be a founding member of and continue to be the chief operating officer for. That was called together by one of the best entrepreneurs in healthcare, a nurse named PK Shirley. And PK reached out to 18 of her friends in healthcare and somehow me as well. I'm very fortunate to have been included in this group, but said, this is in April of 2020, and it was very clear that the writing was on the wall, that things weren't going to get better soon, and that our nurse colleagues, and more importantly, the public, were really going to suffer as part of this pandemic. So she called us all together and said, hey, we need to find a way to elevate the profession of nursing while improving health outcomes. And, by being nurses, we do that anyways. Right. So let's find a way that we can partner with the public, not create another nursing organization, but create a public health organization that's run by nurses to help the public achieve their health goals. So it's been a phenomenal journey. I encourage anyone who's listening to check out our website at nurseseverywhere.com, but led by, I think, 4 past American Nurses Association presidents, the current president of the ANA, a lot of wonderful leaders, entrepreneurs in healthcare, the past American Hospital Association president. So it's all these amazing leaders who are totally selfless and are just really committed to making their communities thrive. So we started Nurses Everywhere to give the public a voice and to be partners with nursing in that venture. And we've done it in a lot of fun and interesting ways. First, we wanted to know what the public thought about nurses during the pandemic. So we collaborated with the Harris Poll and sent out a survey to over 2,000 individuals in the US to ask them how they felt about nurses. And, we knew that we were a trusted profession, that people loved us. from that realm. But what we weren't sure is, are they enjoying this additional access to nurses that was occurring as part of the policies or surrounding the pandemic? So we found that 89% of Americans want the same access to nurses after the pandemic as they're receiving during the pandemic. And 91% want safe and standard staffing ratios within health systems. And 90% want those same safe staffing ratios within nursing homes. So not only does the public trust us, but we found new information or information that validated that they value us and they see the role that we have in their healthcare. So together we wanted to figure out what the next steps would be to continue this partnership and really improve community health in the United States. Because if you look at our outcomes, they're nowhere where they need to be right now.
No.
So that's a tricky scenario, right? How do you have a public health organization that's run by nurses that's for the public? And we first wanted to see, all right, what can we do to raise awareness and change that narrative of what people think of nurses? So, for example, I gave an innovation talk in Australia this fall, and one of the co-presenters behind the scenes in Zoom sent me a picture of Greg Fokker from Meet the Parents after I presented and said, was this inspiration for you? And it was, I'm sure, lighthearted and you meant to be kind, but it really tells you how the public worldwide views nurses, and in my case, a male nurse. Mm-hmm. So we wanted to change the narrative and focus on gratitude, focus on the work that they were doing, and really capitalize on how the public wanted to help nurses. So we've done two things since then. One, we launched the Thank a Nurse Wear a Mask campaign. We created a PSA and really focused on asking the public if they wanted to impact their own health outcomes, and if they wanted to do that in a way that showed gratitude to frontline clinicians. The best way they could do it would be to follow COVID protocol and wear their mask in public. And then from there, we were approached by a country music duo who had just created a song called "You Didn't Have To." It was really written as what we're going to call the Nurses Week anthem this year. But the husband-wife duo, the husband's mother was a nurse for 35 years in the UK. And we decided that together, nurses everywhere would direct and produce the music video for this. So we were able to pull pictures from nurses from around the world and showcase them in this video. And that got 100,000 views on YouTube in the first 2 weeks. Something that was really elevating the way that the public was interacting with nurses. And now, as we move into Nurses Week, we're continuing to capitalize on that momentum by using what's called the Thank a Nurse contest. And this is our call to action for the public and other health systems or anyone who really wants to get involved to show gratitude for us hopefully reaching the next phase of whatever the pandemic may be, by creating their own video to that song and submitting it on social media and our website at nurseseverywhere.com. Winners, the winning submission is going to get a private conference or a private concert from Brown and Gray. And there's a bunch of other great swag and prizes to people who participate in it. So it's a really fun way for the public to get engaged. But more importantly, in the contest, but more importantly, it's a really great way for the public to engage with nurses everywhere so that we can continue to bridge that gap between nurses and public health and really improve health outcomes into the future.
Wow, you've hit on so many incredible and important value statements related to nursing, our role in the community, our role in public health as well. First, I think it is nurses are natural collaborators, and we've always been looked upon as the role models in healthcare to demonstrate cross-clinical collaboration, cross-professional collaboration. But knowing you as an innovator, I think you're already talking about a very innovative approach to the role of nursing in our community and our society, where we're redefining what it means to be involved in healthcare, and that has to involve maintaining health as well as addressing challenges in health too. We go beyond the traditional hospital system, and as healthcare transforms, we're going to be right there at the tip of the spear, because I think we both regard nurses as natural leaders as well as conveners, if you will. And I think being able to show leadership in this incredible time of unprecedented challenge to healthcare is just an example of our role within society, within our communities, and within the changing paradigm of health. I think it's really great what you're doing with nurses everywhere, and really appreciate hearing how that came to be, and the good work that you've been doing. I know my boss, Molly, was one of the nurses featured in the video. So we love that connection as well. And I do hope our listeners will check out the Thank a Nurse contest that you mentioned, because that's really cool stuff. I'm going to throw a wild card question at you, because one of the ways you've been inspiring and supportive to me personally is the book that you've recently published with Dr. Bernadine Melnick, another great nurse innovator. Can you tell us a little bit about your book and how it came about? But it's one of my favorite reads, so thank you.
I can, like any good author.
I love it.
My right here. But yeah, this is a very interesting opportunity to me. You know, being in innovation and being a fan of the TV show The Office.
Yeah.
It's been very clear the direction that paper publication has been going for quite some time now.
Right.
So when Springer reached out to us to write this book, we said, well, if we're going to write a book on innovation, then we have to take an innovative approach to that book.
Yes.
And it can't be a textbook like you've seen before. So, you know, we have a couple concessions. One, we have to be able to write in first person, be able to use narrative throughout and implement storytelling. Two, we want to make sure that there are alternative modalities to engage with this, so that there are podcasts that go along with the book, that when you purchase it, you can listen to podcasts with some of the chapter authors. And three, we wanted them to bring in a concept that hadn't been in healthcare in general, which is entrepreneurship and the entrepreneurial mindset. So there's some things on innovation, there are plenty of things on leadership, but the entrepreneurial mindset hadn't been added in. So we said, you know, this is the gap that exists right now, and we want to fill that through this book. So it was a long, arduous journey, but a great opportunity to showcase the work of many of our peers who have been doing this for a long time. They just may not have had something to point to and say, you know, here it is. So we wrote the book, and really have won the American Journal of Nursing's Book of the Year in the Management and Leadership section. And it's just been a very exciting time to see that our peers are recognizing that this needs to be the path that we move forward when it comes to education. And then the beauty about education is that leads to practice. So very excited to see how this book transforms the nursing profession.
And what's the title again? Do you mind showing it to our listeners?
But it's Evidence-Based Leadership, Innovation, and Entrepreneurship in Nursing and Healthcare, a Practical Guide for Success.
And you've actually assembled quite the dream team of nursing practice, nursing leadership, nursing innovation, and then, like we've been talking about, the cross-collaborative view, because it takes a village to accomplish the bold and transformative changes that nurses are aware of as leaders in healthcare delivery. So I just wanted to make sure we gave a shout out to that, because it's such an important work. Well, Tim, thank you so much for your time, and happy Nurses Week to you.
Happy Nurses Week to you. Thanks so much for having me.
Thank you all for watching. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.